What is going on with Trump's tariffs in healthcare? Healthcare is navigating uncertainty following Trump's tariffs. Health executives are worried about shortages and stockpiling supplies. Some are wondering where they could find substitutes for drugs, medical devices, and anything else they get from a foreign country that might raise costs because of these new tariffs.
First, I should say this is a developing situation where things have changed even since I began reporting a few days ago. It's rare that I hear so many sources for a story use expletives, but this was one of those times. Many said that they're just really confused about what the executive order really said about medical supplies used by doctors in hospitals, about what is exempted and what isn't. There was just a lot of contradictory information. To confuse matters more, the president kept talking about all these countries that wanted to make deals. Group purchasing organizations that negotiate contracts for critical supplies from foreign manufacturers. Things like syringes, x-ray film. They don't know which companies in which countries they should contract with when their contracts come up for renewal. So then, apparently in response to congressional and public outcry, Trump basically said, never mind, and postponed reciprocal tariffs for 90 days, except for manufacturers in China, where Trump is imposing an even higher tariff of 125%. It's enough to make you go dizzy. This is still a big concern since a lot of medical supplies are manufactured in China. A major goal behind this effort, of course, to Trump is to bring manufacturing back to the US. But here's the thing. The FDA, which has seen a reduction in force under the DOGE cuts, must inspect any location where medical products intended for sale and use in the US are made to assure safety and regulatory compliance. But the office, whose team arranged for those inspectors to travel to wherever the new plant is going to be, has been gutted, and it's unclear whether many of the inspectors took the buyouts. So if a company wanted to move operations from its plant in a high tariff country to one in a lower tariff country, it might be quite a while before that new location could pass inspection. For instance, if a company that manufactures x-ray film in China also has a plant in Vietnam, and Vietnam has a lower tariff, that company might move its x-ray film manufacturing to Vietnam. But before it can sell those goods to the US, the FDA has to inspect it. Richard Frank of the Brookings Institution, he mentioned that hospitals may be working diligently to prepare for alternatives in case the situation results in a shortage of certain essential medical supplies after these tariffs take effect. But he noted that whenever a system changes something, especially in medicine, like a drug dose, or maybe a surgeon shifts to using a different surgical tool, there is a higher risk of errors, dosing errors, user errors, all sorts of things can go wrong. You have systems in place, but when the holes in the system align, terrible mistakes can slip through.